What if death isn't the end but a doorway? Imagine being clinically dead, your eyes taped shut, your brain silent, yet somehow you can still see not just vague impressions, but precise hidden details. A nurse hiding your dentures in a drawer, a doctor's plaid shoelaces, even events in other rooms saw later verified as shockingly accurate. This is veridical perception in near-death experiences cases, where the unconscious see the unseeable, challenging everything science claims about the mind. Are these glimpses of an afterlife proof consciousness exists beyond the brain? Strap in, we're diving into documented cases where the dead shouldn't have seen, but did. Confirmed sightings. Veridical perception of hidden objects in near-death experiences. Introduction: the phenomenon of veridical perception in NDEs, near-death experiences, NDEs, often involve profound subjective phenomena, but among the most scientifically compelling aspects are reports of veridical perception. Veridical NDE perception, VNDE, refers to instances where an individual, during their NDE, acquires information about the material world that is later corroborated as accurate and which they could not have obtained through their normal sensory channels due to their physical condition, e.g., unconsciousness, cardiac arrest, general anesthesia with eyes closed or taped. These confirmed sightings of hidden objects or events present a significant challenge to conventional understandings of consciousness and its relationship to the physical brain, suggesting that awareness may, at times, operate independently of the body's sensory apparatus. The rigorous documentation and corroboration of such cases are of paramount interest to researchers, as they offer potential evidence for consciousness persisting beyond the limitations of the physical senses. The nature of hidden observations. What makes certain observations during NDEs hidden is the clinical state of the patient and the circumstances surrounding the perceived events. In many documented cases of veridical perception, patients are clinically unconscious or in cardiac arrest. Their brains are presumed to be severely impaired or non-functional, rendering normal sensory input and processing highly unlikely. Under general anesthesia, often with their eyes taped shut for protection, eliminating the possibility of visual input, observing from an out-of-body perspective, reporting details from a vantage point physically impossible for their body, e.g., from the ceiling, observing their own resuscitation. Perceiving obscured objects, noticing items or details that would not be in their direct line of sight, even if their eyes were open and functioning, e.g., objects in another room, specific items on a high shelf, or details of surgical instruments not visible from a supine position. The confirmation that patients accurately perceived such hidden information under these conditions is what lends these accounts their evidential weight. Researchers emphasize that visual veridical perceptions are particularly compelling when eyes are confirmed to be closed or covered, as auditory perceptions might, in rare cases, be attributed to some residual hearing under anesthesia. Documented cases of veridical sightings. Medical and research literature contains several well-documented cases where patients reported seeing hidden objects or specific unexpected details during their NDEs, which were subsequently verified. These accounts often come from patients who are unconscious, under general anesthesia, or in cardiac arrest. The case of the dentures. One of the most widely cited examples of veridical perception involves a patient who, after being resuscitated from a cardiac arrest and deep coma, informed a nurse that she knew the whereabouts of his dentures. He then accurately described the specific nurse who had removed his dentures during the resuscitation, the appearance of the cart on which they were placed, the particular sliding drawer where they were put, and their exact location within that drawer. The patient claimed to have observed these actions from an out-of-body perspective while clinically unconscious. The detailed and verifiable nature of this hidden object sighting makes it a cornerstone case in NDE research. Observations during general anesthesia with eyes taped shut. Several accounts detail patients accurately perceiving visual elements of their surgical procedures or the operating room environment despite being under deep general anesthesia with their eyes taped shut. One patient under general anesthesia with taped eyes reported seeing a nurse passing surgical instruments and also perceived anesthesia and echography machines located behind her head. A physician, also under general anesthesia with taped eyes, reported hearing the anesthesiologist ask about blood loss and the surgeon's reply, and then suddenly seeing into the room, including bags of blood on an IV pole, and the anesthesiologist crouched down. Another patient in a similar state, general anesthesia, eyes taped, reported hearing the anesthesiologist speaking loudly and asking for different medicines, and also seeing this doctor down by their feet, a position the patient found odd. These cases are significant because the visual information obtained should have been entirely inaccessible through normal sensory pathways. Specific and unexpected visual details. Other cases involve patients reporting highly specific and often unexpected visual details that were later confirmed. During a cardiac arrest, one patient reported seeing a researcher with plaid shoelaces from an elevated perspective while observing what happened the day they died. This unique detail was subsequently verified. Another cardiac arrest patient described seeing a researcher with something over their face pushing air into them and wearing a yellow smock. A patient under general anesthesia and in cardiac arrest reported seeing the surgeon and another doctor standing in a doorway with their arms folded, talking, and also seeing post-it notes on a TV screen. One patient, unconscious with closed eyes, reported seeing a blonde therapist panicking and hiding behind curtains during their medical crisis, a detail unlikely to be guessed or inferred. Seeing events in other locations. Some NDEs report witnessing events occurring in different locations, such as other rooms in the hospital or even at home, which are later confirmed. One study reportedly found that 90% of individuals surveyed about their out-of-body experiences during NDEs were completely accurate in recounting what they had witnessed from a different location. Scientific scrutiny and corroboration. The scientific investigation of veridical NDEs relies heavily on meticulous documentation and independent corroboration. Researchers aim to collect the NDE's account before any potential feedback or contamination can occur. This is followed by seeking confirmation from witnesses or other sources regarding the accuracy of the reported perceptions. A systematic review of veridical NDEs included 11 studies, each detailing single cases of such perceptions occurring during severe illness, general anesthesia, or cardiac arrest. 10 of these 11 cases involved visual perceptions. The review highlighted that the evidence for perceptions bypassing sensory organs is considered more plausible for visual experiences than auditory ones, particularly when participants' eyes were confirmed to be closed. Institutions like the Division of Perceptual Studies, DOPS, at the University of Virginia, actively seek out and study veridical NDEs because of their profound implications for understanding consciousness. The goal is to rigorously evaluate the evidence and rule out conventional explanations such as prior knowledge, inference, or subtle sensory leakage, challenging conventional explanations. Veridical perceptions of hidden objects or events pose a significant challenge to purely physiological or psychological explanations of NDEs. Hallucination theory. If NDEs were merely hallucinations produced by a dying or stressed brain, e.g., due to anoxia, drugs, or neurochemical imbalances, it would be difficult to explain how these internal experiences could accurately correspond to objective external realities, especially those hidden from the senses. Sensory leakage. While some auditory awareness might rarely persist under anesthesia, the detailed visual perceptions reported when eyes are closed, taped, or when the patient is observing from an out-of-body vantage point are harder to attribute to simple sensory leakage, confabulation, or expectation. The specificity of the details observed, e.g., plaid shoelaces, location of dentures, specific actions of medical staff, often goes beyond what could be reasonably guessed, confabulated, or expected based on prior knowledge or cultural conditioning. The consistent reporting of such anomalous perceptions, corroborated by independent verification, suggests that consciousness may possess capabilities beyond those currently understood within a purely materialistic framework of brain function. Implications for understanding consciousness. Confirmed sightings of hidden objects during NDEs carry profound implications. If consciousness can perceive aspects of reality when the physical senses are non-functional or occluded, it suggests that consciousness may not be solely produced by or confined to the brain. The brain might act more as a filter or receiver for consciousness rather than its ultimate generator. Out-of-body experiences may involve a genuine separation of some aspect of consciousness from the physical body, allowing for perception from a different spatial perspective. These possibilities, supported by veridical evidence, encourage a broader scientific inquiry into the nature of consciousness and its potential to transcend physical limitations. The shocking nature of these confirmed sightings lies in their direct challenge to the dominant scientific paradigm that equates mind entirely with brain activity. Conclusion. The weight of veridical evidence. The accumulation of documented and corroborated cases where NDEs have accurately perceived hidden objects or events provides compelling, if not yet conclusive, evidence that challenges purely materialistic explanations of consciousness. While skepticism remains and rigorous investigation must continue, these confirmed sightings cannot be easily dismissed as mere anecdote or hallucination. They point towards the possibility that human consciousness may have the capacity to obtain information about the physical world under conditions where such perception should be impossible, according to our current understanding of sensory biology and brain function. The ongoing research into veridical NDEs, particularly those involving the perception of hidden details, remains a critical frontier in the quest to understand the full nature of consciousness and its place in the universe.